Hello and welcome. It's wonderful to have you here with us today. Now let me ask you something right off the bat. When you think about your blood pressure, do you feel completely in control? Or is there a little nagging voice that wonders if you're missing something? It's a common feeling, and you're certainly not alone. You see, high blood pressure, often called that silent killer, has a sneaky way of creeping up, especially as we gain more wisdom and years. It doesn't usually shout for attention with obvious symptoms, does it? Instead, it can quietly build, day by day, until perhaps a more serious event, like a heart attack or stroke, suddenly brings it into sharp focus. And what's truly concerning is how easy it can be to overlook the very habits that might be contributing to the problem. Even when we think we're doing all the right things, many of us, especially those of us cherishing our 50s, 60s, and beyond, believe we're ticking all the boxes. We're taking our prescribed medications, we're seeing our doctors for checkups, and we're genuinely trying to stay active. But what if I told you that lurking within those well-intentioned routines are subtle, often invisible missteps? These aren't glaring errors, but tiny, seemingly harmless habits that could be slowly, steadily nudging your blood pressure upwards, or just as worryingly, making your current treatments less effective. Think about it. These hidden factors, unless we shine a bright light on them, continue to exert that quiet pressure on your heart, your brain, and your entire circulatory system. It's a serious matter, and that's why what we're about to discuss today is so incredibly important. Our mission here isn't to overwhelm you with complicated medical jargon or to make you feel judged about past choices. Not at all. We're here to offer clear, straightforward information. We want to highlight some of the most common and often misunderstood blood pressure blunders we see, particularly in our senior community. And more importantly, we're going to explore practical, actionable changes you can make, changes that can lead to truly meaningful improvements in your health and your daily life. Whether you've been managing hypertension for years or you're just starting to keep a closer eye on those numbers, this guide is for you. It's about empowering you to take genuine charge of your cardiovascular well-being. Because let's be honest, managing blood pressure effectively is about so much more than just a number on a monitor, isn't it? It's about feeling energetic, thinking clearly, sleeping soundly, and approaching each day with confidence and vitality. And that journey, that wonderful journey, starts by understanding what not to do and what powerful alternatives you can embrace instead. So, before we dive into the very first common misstep, I'd love to hear from you. What's one thing about managing blood pressure that you find particularly challenging or confusing? Drop a comment below. I personally read them, and sharing our experiences helps our whole community learn and grow stronger together. And if you haven't already, do consider subscribing and hitting that notification bell so you don't miss out on our latest insights for living your healthiest life. Now, for many folks, the journey of managing high blood pressure often begins with a prescription from their trusted doctor. And let's be clear, these medications can be absolute lifesavers. They are incredibly effective tools for keeping those numbers in a healthier range. But here's the catch, and it's a big one. Their power, their effectiveness, hinges entirely on using them correctly and consistently. One of the most common and frankly troubling issues we see is when individuals miss doses, take their medication at erratic times, or perhaps most dangerously, decide to stop their prescribed treatment altogether without even a conversation with their healthcare professional. It might seem like a small thing, perhaps a forgotten pill here or there, but these inconsistencies can have significant and sometimes severe, ripple effects over time. Why does this happen? Well, the reasons are as varied as we are. Sometimes it's simple forgetfulness. Life gets busy. For others, they might start feeling pretty good. Their numbers might even look better, and they think, "Aha, I don't need this anymore." Then there are valid concerns about side effects. Nobody enjoys feeling unwell from a medication meant to help them. And for some, there's an understandable unease about the idea of long-term medication dependency. I have also heard of individuals trying to stretch a prescription by splitting pills or taking them every other day, perhaps to save money or reduce perceived side effects. While these decisions might feel logical or even necessary in the moment, they can unfortunately lead to dangerous swings in your blood pressure. Imagine a car constantly speeding up and then slamming on the brakes. That's the kind of stress it puts on your heart and blood vessels. This erratic pressure can increase your risk of stroke, kidney damage, or even heart failure. You see, your blood pressure medication isn't just a random pill. It's been carefully chosen and dosed specifically for your body and your unique needs. It's doing more than just lowering a number. It's working behind the scenes to protect your entire cardiovascular system. When doses are missed or taken inconsistently, your blood pressure can spike unexpectedly. At first, you might not even notice these little surges. But over time, like water slowly eroding rock, this can silently damage your arteries and put an extra, unnecessary burden on your vital organs. And because high blood pressure often doesn't have obvious symptoms, many people remain completely unaware of this internal struggle until a crisis hits. It's also crucial to understand something that many people miss. Blood pressure medications don't typically give you that immediate feel-better sensation like an antibiotic for an infection or a pain reliever for a headache. You might not feel a distinct change after taking your pill, and this can lead some to underestimate just how vital that medication is. But rest assured, it's performing critical tasks, reducing strain on your heart, improving your circulation, and significantly lowering your risk of serious health events. It's like having a silent guardian working tirelessly for you. The wonderful news? This particular mistake is almost entirely preventable. The first step is to reframe how you see your medication. It's not an optional extra, it's a fundamental part of your daily wellness routine. Try to take it at the same time each day. Use tools to help you remember. A simple pill box, an alarm on your phone, or even a daily checklist can make a world of difference. And if you do miss a dose, please don't just guess what to do or double up next time. A quick call to your doctor or pharmacist for advice is always the best course of action. And what if you're experiencing side effects? Don't suffer in silence, and definitely don't just stop the medication. Talk to your doctor. There are often alternative medications or dosage adjustments that can manage your blood pressure effectively while minimizing or eliminating those unwanted effects. Your comfort and your heart health are both paramount. Remember, even if your blood pressure readings start to look normal, that's often a sign the medication is working, not a sign that you can stop it. Always consult your physician before making any changes to your medication regimen, no matter how small they might seem. Even slight adjustments in timing or dosage can have a big impact. And if cost is a concern, please discuss this with your healthcare provider too. There are often generic alternatives, discount programs, or patient assistance initiatives that can help. Your well-being is worth advocating for. Ultimately, managing your blood pressure effectively through consistent medication isn't about restriction. It's about dedication. It's a commitment that pays off in enhanced energy, greater stability, and a profound sense of peace of mind. One pill, one day, one consistent decision at a time. That's your powerful contribution to a healthier, more vibrant future. All right, let's talk about salt. Many of us are conscious about not overdoing it with the salt shaker at the dinner table, right? But what if I told you that the salt you add to your food is often just the tip of the iceberg? A huge and commonly overlooked mistake in managing blood pressure is underestimating the sheer amount of sodium that's secretly hiding in the everyday foods we eat. Now, why is this such a big deal for blood pressure? Well, high sodium intake is directly linked to higher blood pressure levels. Think of it this way: salt acts like a magnet for water in your body. When you consume too much salt, your body holds on to extra water. This extra water increases the volume of blood flowing through your vessels, and more volume in the same space means more pressure on your artery walls. Over time, this constant, elevated pressure can wear down your heart and significantly increase your risk for serious issues like stroke, heart attack, and kidney damage. The tricky part is that these effects are often subtle, building up gradually. And it's even trickier to remember all the surprising places where sodium loves to hide. We're not just talking about obviously salty snacks like chips or pretzels. Sodium is a master of disguise. It's lurking in many packaged foods. Think canned soups, sauces, frozen dinners, breads, deli meats, and even seemingly innocent choices like low-fat salad dressings or whole-grain crackers. You'd be amazed. Why is it there? It's not just for flavor, though that's part of it. Sodium is also a very effective preservative, extending the shelf life of many products. This means that even foods marketed as light, diet, or heart-healthy can still pack a surprising sodium punch to keep them tasting good and lasting longer on the shelf. So if you're regularly consuming these convenient, familiar foods, you could be taking in a lot more sodium than you realize day after day. This issue is particularly important for us as we age. Our kidneys, those amazing filtering organs, naturally become a bit less efficient at processing and removing excess sodium from our bodies. This means that the same amount of sodium that might not have caused much of an issue in our younger years can now have a more pronounced effect on our blood pressure. It can also contribute to fluid retention, which can worsen conditions like leg swelling or even congestive heart failure. So what's the game plan for tackling this sneaky sodium? The first, most powerful step is awareness. Start becoming a label detective. When you're shopping, look beyond just the calories and fat content. Zero in on that sodium number. You might be genuinely shocked at what you find. For instance, a single serving of some canned soups can contain more than half of your entire recommended daily sodium intake. Even everyday staples like a slice of bread or a serving of cereal can contribute significantly if you're not careful. What should you look for? Aim for products labeled low sodium, which typically means 140 milligrams of sodium or less per serving. Even better are those with no salt added. And here are some more actionable tips that can make a real difference. Rinse, rinse, rinse. When you use canned beans or vegetables, give them a good rinse under running water. This can wash away a surprising amount of excess sodium. Fresh is best. Opt for fresh or frozen fruits and vegetables whenever possible. If you choose frozen, pick ones without added sauces, as those can be sodium traps. Home cooking power. Cooking more meals at home gives you complete control over the ingredients. You decide what goes in and how much. Flavor boosters. Get creative with herbs and spices. Lemon juice, vinegar, garlic, onion powder, black pepper, and a whole world of dried herbs can add incredible flavor to your dishes without adding a grain of sodium. You'll find that your food tastes even better. Now, I know what some of you might be thinking, but I like salty food, and that's understandable. Retraining your taste buds does take a little time and patience, especially if you've been accustomed to higher salt foods for a long while. At first, lower sodium options might seem a bit bland, but stick with it. Your palate will adjust. After a few weeks, you'll start to appreciate the natural, subtle flavors of foods much more. And you might even find that those super salty foods you used to enjoy now taste overwhelmingly intense or less appealing. It's a fascinating process. Lowering your sodium intake isn't about deprivation or making your food boring. Not at all. It's about making conscious, empowering choices that protect your heart, support your overall well-being, and allow you to enjoy a life filled with more clarity, vitality, and stability. Every bite truly does count. Each meal is an opportunity to nourish not just your hunger, but your long-term health. Think of it as an investment in your future self. Let's shift gears a bit. We've talked about medications and diet, but what about keeping track of things? Blood pressure, as we know, is a bit of a chameleon. It's not something you can usually feel, is it? Not until it reaches a critical point, or heaven forbid, leads to a major health scare. And that's precisely what makes it so deceptive. You could be going about your day, feeling perfectly fine, maybe even quite healthy, all while your blood pressure is quietly inching upwards. This brings us to a very common and potentially dangerous oversight, especially for seniors. The lack of consistent blood pressure monitoring, or perhaps relying only on those readings taken during annual doctor's visits. Now, why is this a problem? Without regular, consistent oversight, small but significant changes can easily go unnoticed. And these seemingly minor shifts, if left unchecked, can snowball into much bigger consequences down the road. Think about it. Your blood pressure isn't a static number. It naturally fluctuates throughout the day, influenced by a whole host of factors: your stress levels, the quality of your sleep, what you've eaten, your physical activity, even the weather. So, that single measurement you get at the doctor's office, while important, is really just a snapshot in time. It doesn't give the full picture, does it? In fact, for some people, clinic readings can be a bit skewed. You might experience white coat hypertension, where your blood pressure is higher simply due to the stress or anxiety of being in a medical setting. Conversely, if you happen to be having a particularly calm and good day, your reading might be unusually low, masking an underlying issue. This is precisely why at-home blood pressure monitoring can be such an incredibly powerful tool. It's not about becoming obsessed with numbers, but about gaining valuable insights into your body's unique patterns over time. This understanding isn't just interesting, it can be absolutely vital for your long-term health. When you neglect regular monitoring, you might be missing crucial warning signs. Perhaps your medication isn't as effective as it once was. Maybe a new dietary habit or a new stressor in your life is starting to impact your numbers. Or consider this: have you recently started a new supplement or over-the-counter remedy? Some of these can, surprisingly, interfere with your blood pressure or its medication. Without consistent readings, you and your doctor are essentially working with incomplete information. And when it comes to your heart health, guesswork simply isn't good enough. Taking your blood pressure at home isn't complicated, and it's incredibly empowering. It allows you to spot patterns, detect any unusual spikes early on, and provide your doctor with invaluable data to fine-tune your treatment plan. You're no longer just a passive recipient of care. You become an active, informed partner in your own health journey. You're not just waiting for results, you're actively shaping them, one reading at a time. And you don't need sophisticated medical training or expensive, complicated equipment. Modern home blood pressure monitors are very affordable, user-friendly, and often come with features like large, easy-to-read displays and built-in memory to store your readings. The key here is consistency. Try to pick a specific time of day, perhaps first thing in the morning, before medication and breakfast, or in the evening before dinner, and measure your blood pressure around the same time each day. Here's a little routine I often suggest. 1. Find a calm moment. Don't rush. Sit quietly for about 5 minutes before you take your reading. No distractions, no hustle and bustle. 2. Get comfortable. Sit in a chair with your back supported and your feet flat on the floor. Rest your arm with the cuff on at about heart level on a table. 3. Stay still and silent. Avoid talking or moving around while the monitor is doing its work. Making this a regular practice, like brushing your teeth, helps you develop a clear and accurate understanding of how your body is functioning. And please keep a log of your readings. Whether it's a simple notebook or a dedicated app on your phone, this record is gold. Bring it with you to every doctor's appointment. It makes your visits so much more productive. Your healthcare provider can see trends, identify if your medication needs adjusting, or spot early warning signs before they escalate into more serious problems. I know some people avoid monitoring because they're afraid of what the numbers might show. They worry that a high reading will cause more stress or anxiety. But here's a thought I want to leave you with. Ignoring your blood pressure doesn't protect you from it. It simply allows potential issues to develop unsupervised. Awareness, on the other hand, is the first step towards improvement, and with blood pressure, early detection truly is critical. Think of monitoring your blood pressure not as a chore, but as an ongoing, insightful conversation with your body. It's a dialogue that thrives on consistency, calmness, and mindfulness. Make it a non-negotiable part of your daily routine. Prioritize it, because your future health truly does depend on the informed decisions you make today. It's a small investment of time for a massive return in well-being. And that brings us to the end of our deep dive into these common yet often overlooked blood pressure mistakes. Remember, managing high blood pressure isn't about achieving some impossible state of perfection. It's not about a life filled with constant restrictions or endless worry. Far from it. It's about understanding those crucial daily habits, understanding the subtle cues your body sends you, and most importantly, understanding the incredible power you hold to positively influence your health with every single choice you make. Your blood pressure is so much more than just a number on a screen. It's a reflection of your body's amazing ability to sustain life, to breathe, to rest, to move, to think, and to interact with the wonderful world around you. These aren't drastic and overwhelming changes. They are realistic, they are attainable, and they empower you to enhance your life without needing a complete overhaul. They are all about embracing a consistent, intentional, and loving approach to prioritizing your own well-being. Whatever small step you choose to take, please know this: every single action, no matter how minor it may seem, contributes to a healthier heart, a more stable an energetic life, and a stronger, more resilient you. Thank you so much for spending your valuable time with us. Let's support each other in embracing these truths and moving towards greater health, vitality, and joy, one heartbeat, one conscious choice at a time. Until next time, take wonderful care.